Hi, my name is Dr. Benjamin Lam. I'm a board-certified plastic surgeon, and I want to tell you a little bit something about me. I have been in private practice for the past 17 years now. Actually, started off not as a plastic surgeon, but rather in anesthesia. I had dreams of being an anesthesiologist way back, and went through about half of my residency and realized that it was not my calling. In fact, what I started doing was I started peeking over the curtains and seeing what the surgeons were doing on the other side. And it was a tough decision, but at some point I made up my mind that the surgical field was for me. So from that point on, I switched into general surgery and got my basic training, and along the way really have had a chance to sort of explore other opportunities. And what I found was plastic surgery was really perfect for me in that I get to work basically from head to toe on a patient. And so we're going to talk a little bit about fillers. Fillers is one of those things that is getting hugely popular along with Botox. And typically fillers are used for the lower third of the face, where with the process of aging, you're forming some lines because some loss of volume. I'm Dr. Lam. Hi, nice to meet you.
Nice to meet you.
So what brought you in today?
So my daughter's getting married next week, and I want to get a little bit of lip filler. I mean, I'm 60, so like I don't want to look crazy, but I just want to get a little more fullness.
But in this case, the problem is volume loss. So we're trying to replenish or sort of add back the volume that you've lost during the aging process. So some common areas are the nasolabial fold, or some of my patients call those the parentheses lines. Some people with the aging process, they lose volume in their lips. So I think that you're perfect candidate for some tissue fillers, right, that we do to the bottom third of the face, and especially people love the plumping effect around the lip area. Philosophy wise is we're going to go a little bit conservative since it's my first time injecting you, right?
Okay.
And I can always give you more. And in fact, you're going to see there's a mirror around the corner here that I'm going to keep showing you along the way.
Oh, good.
And you can stop me at any time. We have found that applying ice is actually better than any numbing cream or any dental blocks and stuff like that.
Okay.
So we're going to supply you with that. You're just going to hold it over the area and for a few minutes, and it really deadens that sensation a lot. But I will tell you, at the end of the day, you're still going to feel a little something, but really it's quite tolerable. So I'm going to wipe you off, Donna, because obviously this is a product that's going to be injected underneath the skin, so we want to keep your skin as clean as possible, right? So this is a 27 gauge needle, very tiny as I said. I'm not going to sneak up on you or anything like that. Okay. So I'm going to do your left upper lip first. Okay. So you can just relax and let me do. I know that you're going to want the red part of your lip, so a little pinch right here. And then now you're going to feel some of the product just kind of rolling down towards the lateral side of your lip. Okay. Everything's going very well. And I'm not going to act like the dentist and talk to you at this time, so you just relax. Okay? Good, excellent. And one of the more popular brand of fillers on the market today is called Juvederm, made by Allergan. And the beauty about Juvederm is that the active ingredient is actually natural. It's hyaluronic acid, which we have in our bodies. Only that in Juvederm, it's cross-linked in the lab so that when we inject it underneath the skin, it stays around longer instead of being chewed up right away. Lips. Many patients come to me and say, listen, my lips just basically disappeared. And we can restore some volume there with fillers. Would you like to actually see, can you hand me
I
the
would
mirror?
love to see. Yeah.
The difference before I inject the opposite
Yes.
side? A typical treatment can last maybe from 8 to 10 months, the results. And it's very natural. In fact, one of the hook lines from the company is that it's the science of being smooth, because it's It has a very nice handling characteristics while you're injecting it. And you don't really typically form lumps underneath the skin or anything like that, so it's a very natural look with this filler. This is the side that I
Oh,
inject,
that's perfect.
Right.
That's just enough.
Right.
Yep.
Okay.
Yep.
So you get the plumpness in the red,
Yep.
not raising up the vermilion border.
Yep.
Okay, and every day is sort of an exciting thing for me, never boring and always challenging. I think that I find plastic surgery the most rewarding for me because it's sort of like being a problem solver. Now that we've done both sides of the upper lip, okay, and I've kind of massaged that out.
Oh, that looks good.
Now that I have told you a bit about myself, I look forward to working with you in the near future. If you have any other questions, please feel free to set up a complimentary consultation with me. All of my contact information will be shown at the bottom of this screen, and thank you very much for your time.